Hey, today I'm going to talk about how to interact effectively with mentors, and this could apply to doctors or things too. Obviously, I'm in healthcare setting, and so I always think of these things in terms of health. But the concept here is that sometimes we go into an interaction with with a mentor, with a counselor, with a doctor, with some situation with that. Probably happens with our spouse every day, but we have this psychological bias, like a confirmation bias, where what we want is we go into that interaction knowing what we want out of it, kind of knowing what we want, the advice we want to get. So we don't want advice that we don't want. We want advice that we want. So we go into an interaction kind of closed-minded, already seeking the confirmation of what we wanted, as opposed to going in open to somebody with more experience or outside the situation or whatever it might be, to actually get their advice and opinion. And in a health setting, what I see is sometimes people, they want confirmation of what they're already thinking or what they want to do or not do, and the level of kind of intervention or something that they do or don't want to make to change it. And so they go into that interaction, in this case, with the doctor, kind of seeking confirmation of that, instead of coming in saying, if somebody has a lot of experience and success with this, what would you do? They don't ask that. They're kind of maybe looking for, looking for confirmation of what they're telling you. And, I think that plays into our just life the way it is. We often don't get heard. People don't listen to us. And so we have this lack of confirmation when we don't have people in our life that listen to us and respect us and maybe converse with us and things. But that can be a big mistake when you have a high impact decision and you're interacting with people with something of consequence, or possibly a paid mentor, but somebody that clearly has a different perspective and level of experience or ability to get results than we do. And we go into that already kind of subconsciously, maybe consciously, but subconsciously, knowing what we want to get out of that, instead of going in open to what would the perspective on this person or who has expertise in this be. So a little bit of a challenge there. I know that, this is something that we all deal with, and so I'm challenging myself here. But in your situation there, can you think of a time where that might have happened there, and what can you do? How can you mentally, before you go into a situation, counselor, coach, pastor, doctor, mentor, something like that, how can you get yourself into a state of openness where you're kind of checking yourself for what you think you want out of that interaction, instead of kind of defining what you want and then going in open to their assessment?